Okay, good afternoon, everyone. Thank you, Sages, for inviting me, and actually, thank you for the previous speaker for greatly easing my job by giving the introduction of for HoloLens and basically helping my role in introducing what mixed reality is. So basically, my presentation is about mixed reality for surgery. So utilizing holograms actually to assist clinicians and surgeons throughout their surgery itself. So bit of a a bit of a disclaimer. I am not a surgeon. I am actually an emergency physician, but also as well as software engineer and data scientist in NUHS, working as a deputy director, because I believe this increasing world of tech with medicine, you need a better understanding of both worlds. So I just have a disclaimer that all work presented today represents kind of work in development. And I think currently the cases I'm going to present today is actually only 2 cases, but we have further expanded to about 5 to 10 different cases for this surgery. So a brief understanding, I know many of you here are surgeons. Unfortunately, I am not. So laparoscopic adrenalectomy, I think is quite familiar to many of you, is favored over open surgery for benign adrenal tumors and can involve either the transabdominal or retroperitoneal approach. The main benefits of the laparoscopic retroperitoneal approach is decreased operative time and avoidance of intra-abdominal adhesions and structures. The predominant disadvantage, however, is that this method involves perceived lack of anatomical structures for pot placement and dissection, involves and can affect surgeon with a small working space. So I think, like mentioned by my previous presenter, mixed reality involves both merging VR as well as augmented reality, using holograms to kind of assist clinicians interacting with the real world. So HoloLens 2, I think I'll just briefly skip over this because I think this was quite well explained by my presenter before. So NUHS in Singapore have kind of delved quite far deep into this program, realizing the different capabilities of HoloLens and this technology to help apply it to surgery. We are using mixed reality to help improve the clinician experience and hopefully also improve patient outcomes at the same time. Using the multiple cameras and sensors to kind of assist the clinician. So not only cameras and sensors is outward facing, seeing the environment, but also inward facing, looking at your eyeballs and your line of sight of vision. Many of the files that we dropped for this case was actually DICOM files that we pulled from our PAC system, preoperative CT scans that we uploaded to the HoloLens to kind of used for the surgery itself. And like I said, HoloLens 2 is a self-contained device, and you don't need any additional devices or any additional connection to it. So the patients in our case report actually underwent elective laparoscopic adrenalectomy via the retroperitoneal approach. One case was for the left side and the other case was for the right side. So the patient was positioned in a jackknife position, and the use of the HoloLens mixed reality was used as an excellent adjunct to help guide pot placement due to its ability to display superimposed images onto the reconstructed preoperative CT scan onto the patient body after positioning. So as you can see here, the operating surgeon used the superimposed CT scan image to draw the outline of the target adrenal gland and the ipsilateral kidney on the patient's skin, and then serves as a guide for the surgeon for pot placement and the direction of dissection. So I think this is a rough video of one of the surgeons. I'm actually the one usually tech support in operating theater for many of the surgeons, kind of guiding them through HoloLens as well as how to utilize the software. So as you can see, this is all hands-free. This is done on the patient directly. So previously, the surgeon would kind of use ultrasound to kind of demarcate out what the main structures are. And then subsequently, he will also reconfirm it with the hologram itself by overlaying the high-resolution CT onto the patient. I think an additional benefit of using HoloLens is because it's a hands-free, and I think during surgery itself, the importance of sterility in the surgical field, you are able to actually use the HoloLens again during the surgery itself to kind of interact with the holograms and overlay it during the surgery itself. So this is the same surgeon using the same CT scan later on, keeping the HoloLens on while he's operating. As you can see, it doesn't affect your field of vision in any way, and you can use the hologram to kind of guide and correlate where the key structures are, as well as where your tumor is. So I think for the two cases that were presented, one was a 38-year-old woman with basically with primary hyperaldosteronism, who presented with hypertension, and I think the total time for surgery was about 83 minutes, with final histology showing about 1.8 centimeter adrenal cortical adenoma. Post-operatively, there was no major issues with the case. Similarly, for the second case itself, the total operative time was not longer than typical methods of adrenal surgery. So I think the main point of discussion is utilizing mixed reality headsets to boost the massive ability, utilizing data to kind of help clinicians and surgeons through their surgical process and helping them better use it for surgery. The total use of the headset itself is not overly heavy and should not kind of affect the surgeon while he's operating. I think the main hurdles and challenges with utilizing this technology is still relatively new, whether technology is ready itself, with data using data protection, because we are using the patient's actual scan and utilizing that for the HoloLens itself, and of course a lot of governance and regulations. So far, for the program itself, we have expanded to over 150 different surgeries, not just for adrenal surgery. We have expanded to neurosurgery, cardiothoracic surgery, urology, as well as I think HPB surgery, because I think the main director for the HoloMedicine project is a hepatopancreatobiliary surgeon. And the total team is that of about multiple data scientists as well as software engineers, with 8 active R&D projects at this moment. So I think the main importance is about ensuring a good data infrastructure. So we have basically an AI infrastructure that interacts with our EMR system that actually pulls data, kind of analyzes it, and eventually plans to upload it directly to the HoloLens itself. Yeah, I think one large part of it is because the HoloLens itself has a low compute power, so we actually rely largely on the cloud computing to kind of enable this, and we kind of install our own 5G network in our hospital to kind of help facilitate this. So I think I'm a bit out of time. So thank you.
We have a few questions.
Yeah.
I'm curious, I'm curious, what's the method of spatial registration that's being used to align the scanned image with the actual map?
Thank you for the question. So I think the main issue now is we are working together with the team for auto-registration using key landmarks for registration of where the holograms go. But at this moment, a lot of this is a manual process, hence why it's kind of a work in process. So typical things we do for like urology itself, we use the pelvic eyelid crest. For thoracic, we use the clavicles. Hence why prior to this surgery itself, ultrasound was actually done to kind of actually annotate where the locations of the kidneys are, and then we can kind of further overlay and just reconfirm those locations. So it is still a work in progress, not yet the final product. Yeah.
Yeah, I think the accuracy of that registration is going to be critical.
Yes, it's very, very important. Yeah.
Yeah.
Yeah, I'm excited to see where it goes next, because that was exactly my concern, that with positional shifts, how would those 2D images reconstructed then really, would that represent the real position in that?
So at this point in time, most of this is actually more used for surgical planning rather than that for actual surgery itself. We are working quite closely with the data scientists to kind of basically adapt during the surgery itself to changes in anatomy, because I mean, especially for laparoscopic surgery, where the pneumo itself already does cause a bit of organ deformation itself. So we are working at this point in time, hence quite closely with the software engineers and data scientists to kind of augment with for that.
I do have a technical question. Many years ago, I tried the Google Lens and it was very distracting. I was like on myself looking in the right upper corner more than actually what I wanted to look at.
Mhm.
Did you find that there was a learning curve to people using this, and was it distracting?
So I think the difference between Google Lens and HoloLens, I think, is the difference between augmented reality as well as mixed reality. So if you can see, actually all the holograms kind of stay in the exact place because it actually tracks the environment and places the hologram there. There is still a bit of a learning curve, so that's why usually I'm tech support and operating data when I'm not doing my emergency shifts to kind of guide the surgeons through the process. But I do see it actually after 1 to 2 surgeries, they are quite independent in actually doing the surgeries by themselves and using it for planning. I actually welcome you to kind of try and try the different scan and see and interact with the holograms later if you do have the time.
Right. Thank you very much.
Thank you.